All right, before I start an assessment, I'm going to make sure that I check a patient's signs, precautions, and flags outside of their room. I'm also going to make sure that I check their medical history, and I'm going to gather all supplies necessary for the assessment or task I'm completing. Before I go into Jan's room, I checked her medical history, and I also collected her vitals. All right.
Hi.
Hi, Jan. Before I talk to the client, I'm going to perform hand hygiene. All right. Hi, Jan. I'm Catherine. I'm your nursing student. I'm going to be performing a head-to-toe assessment on you today. Is that all right?
Yes.
Perfect. Before we start, I'm going to provide privacy. All right, good. Can you tell me your name, your date of birth, and your age, please?
My name is Jian, and March 25th, 1990, and 31.
Okay, perfect. Do you happen to know where we are?
We are at the Palpated College.
Do you know about what time of day it is? The afternoon, evening, morning?
Afternoon.
Okay, perfect. So she's aware and oriented ×3 for her person, place, and time. And when she was answering my questions so far, her level of consciousness seems appropriate for the situation. As I look at her while we were talking, I inspected her face, her eyes, her nose, her mouth. They all look symmetrical. I don't see any obvious abnormalities. Okay. To begin the assessment, I'm going to test your cranial nerve 1, which is your olfactory nerve. Can I have you take off your mask, please?
Okay.
I'm going to have you close your eyes, and I'm going to place something below your nose. Can you please tell me what you smell?
Okay. Mint.
Perfect. You can open your eyes again. All right. Next, I'm going to test your cranial nerves 2, 3, 4, and 6, which is your optic, ocular, motor, trochlear, and abducens. Okay, perfect. So I'm going to have you follow the tip of my pen light, please. As I move it, move your eyes, but not your head. Good. Okay, can I have you look over my shoulder? I'm going to turn on this light just slightly to look inside of your pupils. Good. Perfect. Now, can you look at the tip of my pen light and then away from me, far away, and then look at my pen light and then look far away again?
Okay.
Okay. Can I have you pull down your eyes like that for me? Thank you. They look nice, pink. I don't see any extra drainage, discoloration in your eyes, in your conjunctiva or your sclera. Next, I'm going to test cranial nerves 5 and 7, which is your trigeminal and facial. Can you lift your eyebrows for me, please? Can you puff out your cheeks? Perfect. Can you smile for me and then frown? Good. Wonderful. Next, I'm going to produce a sound by your ears, and I just want you to tell me where it's coming from.
Okay.
Can you shut your eyes, please? Thank you. What side are
sorry.
you hearing this?
Left
sound from?
side?
You're okay. And what side are you hearing this?
Right side.
Good. You can open your eyes again. I'm going to palpate your ears by pulling them up and out just a little bit. If you feel any pain during the assessment, please tell me. Okay, I'm going to move your hair out of the way. Okay. Up and out.
No pain.
No pain. It doesn't look like there's any swelling, edema, redness, rash, etc., or odd drainage, and you didn't feel any pain. I would do that on both sides of her bilaterally. right, for now you can, that was your cranial nerve 8, which is your vestibulocochlear. Now I'm going to assess your cranial nerves 7, 9, 10, and 12, which are your facial, glossopharyngeal, vagus, and hypoglossal. Okay? Can you open up your mouth for me and stick out your tongue slightly? And can you say ah? Good, good. Can you swallow for me? No. Perfect. Looking at it, I didn't see any thrush in your mouth. I didn't see any really bad dental hygiene. Those look good. Right. I'm going to take a look at your neck. Your trachea looks midline. I don't see central lines. And I'm going to check for JVD. Can you look this way, please? Thank you. Okay. All right. She has no jugular vein distension. Okay. And then lastly, we're going to test your accessory cranial nerve 11, which is the accessory one. Okay. I'm going to have you push against my hand. Thank you. Good. And again. Good. All right, I'm going to have you shrug your shoulders while I push down. Okay? Just resist it. Good. Perfect. You can put your mask back on. Thank you. So again, while performing that assessment, I didn't notice anything odd about her facial symmetry. I didn't see wounds or lesions, discolorations, odd hair distributions, rashes, etc. And she's also answering all of my questions and following along appropriately. I'm going to palpate your neck. Tell me if you feel any pain. Okay, good. Now I'm going to check for your carotid pulse. And I would do that bilaterally. Okay. So we already checked that the trachea is midline. We've checked for central lines, and we've checked for JVD. I'm going to move on to your upper extremities, okay? First, I'm going to palpate them for temperature and moisture. It looks like you have even hair distribution. It looks like your skin is not discolored. It looks like there are no visible IVs or PICCs. It also looks like there's no visible wounds or lesions. I'm going to check your capillary refill. If I could just have your fingers. Thank you. I'm going to squeeze them. Thank you. And I'm going to check both hands. It looks like, oh, you can put your hand up. It looks like your capillary refill is faster than 3 seconds. So you're good. Perfusion's good. Now I'm going to measure bilaterally your radial pulse of both wrists, okay? I'm just going to put my hand here. And while I measure her radial pulse, I'm going to measure her respirations without telling her. Good. And I would do that bilaterally. Perfect. For the next part of the assessment, I'm going to listen to the 5 cardiac landmarks. I'm going to auscultate and palpate. And inspect. All right. Typically, we would expose her chest so that the stethoscope is on skin, but for the video, we're not going to do that. Before I start, I'm going to listen to the 5 cardiac landmarks. That is your aortic valve, your pulmonary valve, your Erb's point valve, your tricuspid, and your mitral. So the aortic is the second intercostal space on the right side. And then the left side would be your pulmonary. Herb's point would be third. Tricuspid would be fourth. And mitral would be to the side on the mid-axillary line. And I'm going to make sure to listen to her heart using the diaphragm and the bell of my stethoscope. Alright, I'm just going to take a listen real quick. And as I mentioned before, I would do that with the diaphragm and the bell of my stethoscope. Before I do your lungs, do you happen to have any supplemental oxygen or an incentive spirometer? Okay. Perfect. Have you noticed any shortness of breath?
No.
Pain
No.
while breathing? No? Have you ever had trauma to your lungs?
No.
No? Okay, perfect. If she had experienced pain, we would do a pain assessment. That's the PQRST, P for palliate, Q for quality, R for radiate, S for severity, and T for time. Okay, before I start the your lung assessment, I'm just going to look at your breathing. It looks even and symmetrical. She is not struggling. She's not using accessory muscles to breathe and hold her up. Her precordium is also symmetrical. Good. I'm going to listen on my stethoscope, then I'm going to feel a few spots. Okay, perfect. On the front of her chest, I'm going to listen to 6 spots on the right and 6 spots on the left. Those spots would start on the second intercostal space and move to the 4th, the 6th, the 8th, and then the mid-axillary line. Oh wait, sorry, I'm mistaken. They would start right above your clavicle and then your 2nd, 4th, 6th, and 8th. And you can just breathe normally as I go down. Okay. Is it alright if I raise your bed?
Sure.
Okay. Alright, can I have you sitting and facing that way for me, please? Perfect. Can you move your hair from your back, please? So I'm going to just test for symmetry here. Can you just breathe in, good breath, and then a good breath out? Okay. It looks like it's symmetrical, even chest rise, and it doesn't look like she's struggling at all. Before we start, I'm going to be listening to 9 different spots on the right and the left of her posterior chest while listening to her lungs. And they're going to start in the 2nd intercostal space and move down. Okay. Gian, can I have you cross your arms? Perfect. And then put them on your shoulders and just lean forward slightly for me, please. Thank you. The last two spots that I listened to for her lungs, oh yeah, you can sit up, thank you, are on her mid-axillary line and then past that. Okay, all right, now the next part of the assessment will be your bowels. Can you tell me if you've had any constipation or diarrhea recently? Okay, perfect. Have you noticed any odd or irregular patterns in how often you go?
No.
Have you had any pain while pooping? Okay, good. Perfect. And now I'm going to ask her the health history of her bladder. All right, so with peeing, do you happen to use a Foley?
No.
Have you been voiding?
No.
Okay. When you pee, do you feel pain? No pain at all. Have you noticed any odd color or odor?
No.
Okay, perfect. How about the frequency? Is it
Normal.
okay? Good. Good. All right. So now I'm going to do a assessment on your abdomen. I'm going to listen to 4 spots on her abdomen, starting in the right lower quadrant and moving clockwise. Okay. All right. Can I have you put your hands to the side, please?
Like this.
That works. Thank you. So we're going to start in the right lower quadrant. Okay, now I'm going to palpate some areas. Can you tell me if you feel any pain as I lift up? That's supposed to test for rebound tenderness of her abdomen. Okay, I'm just going to palpate. Tell me if you feel pain, please.
No pain.
All right. I'm going to assess your lower extremities now. I'm just going to palpate them for temperature and moisture, and then inspect them for even hair distribution, visible wounds and lesions, rashes, discolorations. It looks like the temperature of your legs are good. The moisture level is also good. I don't see uneven hair distribution or discoloration. It doesn't look like there have been any wounds or bruises or lesions. They look good. I'm going to have you push against my hands. Just do exactly what my hands are doing, the opposite. Perfect. All right. So your strength is good. I'm going to check for your PT and your TP and your DP pulses. That's going to be right here between your big toe and your second one, and then behind your ankle. Good. I realized that I forgot to check her strength on her upper extremities, so I'm going to go back and do that now. I'm going to have you push this way. Oh wait, sorry. Scratch that. Can you do this for me, please?
Okay.
Perfect. Can you grasp my hands now? Good. All right. So her hand grasp and her coordination seem appropriate. Can I have you turn on your side, on your left side, please? I'm going to inspect the bony prominences of the back side of the posterior side of her. I'm going to check the butt and the heels and the knees. Specifically looking for skin breakdown, like pressure wounds, discoloration, anything visible. Good. All right, you can turn back around. Lastly, I'm going to have you stand. Thank you. Can you shut your eyes? Okay, good. Looks like your balance is good. Okay, you can open your eyes again. Can you walk over there, heel to toe, about 5 steps for me, and I will just watch your gait. Good. You are welcome to come back. Did you need help getting back in bed?
No.
Or repositioning at all?
No.
Okay, good. Can I get you anything while I'm still here?
No.
No? Okay. I'm going to lower your bed. Before I had her walk, I should have made sure that the bed was locked and low. Okay, so the bed is locked and low. Your call light is right here. I've gathered all of my supplies out of the room. I'm going to perform hand hygiene and then document the findings from the assessment.